pandemic? What pandemic? In the midst of Missouri's holiday season, it can feel like 2020 was just a blip.
We're healthy and young, and we're not going to miss out on another summer.
Many people here aren't planning on getting the COVID shot anytime soon.
Yeah, I'm not against the science of vaccines, but I am for standing up for people's choice.
A big part of me doesn't know if I really trust it. I think it was a little bit rushed, quite a bit rushed, really.
You have kayak, bud?
The owner of this water sports business is also holding out.
Personally, it just seems like there's a lot of money that's been made or is going to be made off of it. And not that it wasn't vetted thoroughly, but it just is kind of one of those things. Anytime it comes around that quickly, to me, it makes me nervous. I would just like to see how it's going to do before I do it myself.
It's clear that the messaging from the White House that people should trust in the science and get vaccinated for the good of the community is just not working for some people here. So local authorities, finding they can't even give away the vaccines, have started to offer a host of incentives to try and entice people to get the shot. In the city of Springfield, the offer of a free pint is enough to get some people over the line.
Beer is kind of an incentive a little bit to be able to hang out and relax after getting the shot. I was a little anxious about getting it, but...
What we are trying to do with events like this is to go to where the people are, to have trusted partners, places that they go routinely.
And do people actually come for a free beer?
Absolutely. Alcohol breaks down a lot of barriers.
The pub also draws a younger crowd, a demographic health authorities are desperate to reach.
That was it. There you go. Thank you. You're welcome.
At the local hospital, they thought the worst of the pandemic was behind them. But then came Delta.
Can you tell me what we're waiting on room 1? So really, this Delta variant is a game changer. I mean, it's just made things much worse.
In early June, Missouri was averaging 300 new COVID cases a day. In recent weeks, that's increased tenfold.
The volume in the emergency department is very high with patients with COVID symptoms and COVID infections. And then upstairs as well in the hospital, we've got about 150 patients hospitalized right now with COVID.
The patients now are on average younger and sicker and almost always unvaccinated.
Certainly in these past couple of months, I haven't admitted anybody who's been vaccinated.
Across many Midwestern and Southern states, it's a similar story.
Vaccination rates here in neighbouring Arkansas are also well below the national average. We've come to this small community, Siloam Springs, where the governor, a Republican, is turning up to hear community concerns.
The governor calls it a COVID conversation, but it feels more like a few rounds in the ring.
We're going to be living with people dying if we do not increase our vaccination rates. So I still need to get that message out.
What came first, COVID or the vaccine?
What's in the vaccine?
God will not hold you guiltless if you fail to stand up for the Christians who believe it is in their right to abstain from the vaccine.
Governor, we're from ABC Australia. Do you think you changed any minds today?
You know, it's not a question of whether I changed minds, whether the conversation changed minds, and it's really amazing. I think you'll probably go out there and you'll find that some have been vaccinated today.
He's right, the numbers are slowly creeping up, but in these conservative communities, mistrust is part of a political identity.
Sure, whenever you're a conservative, you have less trust of the government. And you ask a lot of tough questions. You have some skepticism, and that's what's reflected.
An optimistic take on the bitter culture war now at the heart of America's latest COVID surge. Barbara Miller, ABC News, Siloam Springs, Arkansas.